You know what? You're just all a very well-behaved group. That's what it is. You're not rowdy, not red. Although I feel like health and climate will get us rowdy, if anything will. So I'm really grateful to be here and with this wonderful panel to kick this one off. And just so you know who I am, I'm the chief meteorologist and chief climate correspondent at ABC News. I went to school to study meteorology. I studied storm chasing and then later got into television. I grew up on a small farm, so food and nature and climate all were a part of my life from a very young age. And I happen to have a mother who is a 72-year-old that just passed her second exams to be a doctor. So pretty exciting. So between the conversations that her and I have and all of the stories that I tell at ABC News, there is no story that doesn't have climate as part of it, but especially when it comes to health. And her and I personally have those conversations often. And so I feel like when you ask to do an intersection of those two things, I'm representing someone very close to me who is finishing her clinicals and maybe gonna do residency. She's nuts. But very much a topic that we talk about all the time. So I'm really happy to be joined today. We've got a whole wonderful panel from the far end here. That's Rob Roy, SVP, Chief Investment Officer, Co-Head of Environmental, Advent Health. And then we have Seema Wadhwa, founder of Health and Climate, and Dr. Chetan Sarabu, right next to me here, who's a pediatrician and climate, health, and AI expert. So we get a little bit of everything. So Rob, why don't we start over by you. As CIO, and this is what my mom and I talk about a lot, about the money when it comes to healthcare, when it comes to the impact of people and climate. On that intersection of health, how is climate change already making a financial risk for health systems? And what are some solutions or resilience that we can build for that change?
So first of all, I'm not sure I can hold a light to your mother. That was a tough bar to set there in terms of like giving good answers. 72 going to medical school. Good on her. That's amazing. You know, I sit in a really interesting seat. I don't know if I've met any other chief investment officers that are also co-head of environmental sustainability for a large organization. And it gives you an interesting perspective into the issues because we sit inside of Advent Health, so we're a healthcare provider. We have 56 hospitals across the country. When I think about it from the physical footprint, we have over 1,000 addresses that we're operating from. And so when I start to talk about this work with our leaders and explain to them what we're doing, the framework that I've generally given them is that, you know, there are impacts that we're having on the world because of the business that we do. Just through the routine of people showing up, driving to work, unwrapping surgical equipment, throwing things away, driving trucks around. There's emissions, waste, and water. And, you know, all of these things have been going on for a long period of time, but when you have the license to start moving throughout your organization and finding creative ways where you could reduce your environmental impact and reduce it in a way that is also financially accretive, so that you're both environmentally and financially accretive, it's amazing because you find all new ways that you can be a blessing to your communities, that creativity unlocked. At the same time though, even if we did all of that work perfectly, you know, just sort of like magically click your heels together and you're the greenest hospital on the planet, the planet's going to continue to have an impact on us. And so there's a resilience component to this as well. And in that space, we think about infrastructure, clinical preparedness, and then sort of legal, regulatory, and compliance. So on infrastructure, like I said, we have over 1,000 addresses that we're operating from. They're all under threat from climate change. We're also spending about $2 billion a year building new things. And so construction design standards have to change in order to get in front of that and not be behind it. And then we're always in the mergers and acquisitions business as well. And so having a climate lens on the things that you're in the process of buying is an important thing that you need to do. And then, you know, from where you sit in the clinical side, we know that the change in climate is going to present a different vector of disease. And so we can either just be sort of like dumb and happy and wait for it to happen and try to react in real time, or we can start to build models that allow us to predict and see these changes and making sure that we're prepared in our communities for what's coming. And the last bit of that is just around legal, regulatory, and compliance. We face a patchwork across the country of rules, and we also don't want to be reactive in that space. We want to be building the framework. So in all of those ways, we're trying to find the intersection of how we can be both environmentally and financially accretive to the organization and our communities.
We've seen it in home insurance, and the reaction there is a lot of times we hear a horror story of, well, I'm just dropped. How are you going to balance the risk management of healthcare with the obvious climate future?
Wow, that's a deep question. I mean, I'm not sure that any of us have the answer to that quite yet. I mean, there's the obvious things that are showing up today, like you said, property insurance. We've faced tremendous amounts of property insurance, but just the presentation of what we're going to see in our hospitals is going to change over time. What we do or not do is going to become a legal liability for us, and so we're going to have to get in front of that. But on the other side of this, the other seat that I sit in is the chief investment officer. Today we have about $35 billion of global capital that we're deploying. We see the threat on the healthcare side, which when you turn that coin over is an opportunity on the other side. The first one to show up for opportunity is on the investment. And so we have a very large dedicated portion of our portfolio that we're putting to work with sophisticated managers who are helping us to benefit from delivering on the climate change, from putting capital solutions in place for robust, clean infrastructure. And so there's that part. What I want to do is I want to go back, though, and think about the opportunity set on the clinical. We clearly all see the threat side of it, but every threat is an opportunity. Somewhere in this, there's an opportunity for us to show up in our communities with things that they don't have. They might not even know that they need yet, but it's an opportunity for us to be a better provider for our communities in the face of the threat. And so I want to collectively brainstorm with everyone, where's the opportunity in this threat that we're facing?
Right. And I think we will get to something like that. We'll talk to Seema now. You've been building that bridge between health and climate, finance, and innovation. So what do you think has been overlooked in the conversation? And then some of the opportunities, maybe we start the brainstorm now, of what we could do in future.
Thanks, Ginger. I've spent the last 20 years leading environmental stewardship programs for some of the largest and most impactful health systems. And where I think the greatest opportunity is, it's around intersectionality. When we talk about some of the challenges, Rob, that you mentioned, that our communities are facing, some of the challenges that clinicians are facing, the opportunity ahead of us is to really bring health in all climate conversations, hence health in climate. But one of the areas that really hasn't been looked at deeply is understanding the financial risk that comes from the health impacts of climate change. Let me unpack that. That's a lot. So, many organizations, many corporations, and now new regulations require companies to do climate-related financial risk assessments, right? They're looking at, those 1,000 facilities, what the physical risk is and what the transition risk is. However, one of the biggest costs for employers is actually health insurance. It's often one of their top 3 to 5 costs, and that's true for families as well. What we have not been accounting for is what is the cost of those, of the health impacts we're seeing. And, these are real material costs. So these extreme heat days that we're having, these severe weather events, those health impacts, the material cost really goes back to the employer. Something like 79% of employees in large companies, so companies with over 500 employees, those companies are self-insuring their plans. So that means that if I'm a large company, if I'm an Apple or if I'm a Google, I'm actually taking on the risk, the financial risk for the health insurance of my workforce. So as there are more and more costs related to the health impacts, how we count those is something that we haven't really looked at. And I'm very excited to share. Just put out a paper. It should be on the website. It'll be on the blog today with a climate group, with Rob, with Dave Jones, who is the the previous insurance commissioner of California, and Kathy Gerwig, who is in this room, where we actually developed a framework at how you can start to make that bridge between financial risk, cost, and health impacts.
Well, congratulations on the paper. So let's move to Dr. Sarabu. You and get to like the nitty gritty of it, because you're a pediatrician, you've seen it. So how do you see climate impacting your patients, the children, their families?
Yeah, thank you so much for asking, and really great to be here on the stage with all of you at this really critical juncture. So I'm a primary care pediatrician, originally from upstate New York, but I spent a good part of my time over the last 10 years in California, in the Bay Area, and I was working in a primary care pediatric clinic, a safety net clinic, largely taking care of children who were recent immigrants. And in 2020 in California in the Bay Area, we were in the midst of COVID, isolation, but we had some of the worst wildfires in California history at that time. And there were almost 45 days in a row in the summer of 2020 where the air quality in the Bay Area was over 150. The AQI, air quality index, was over 150, which is really bad for everybody, but particularly for children with asthma. And I was seeing children in my clinic who were isolated during COVID, and now who couldn't go outside because of the air quality issues. And I was trying to come up with plans for how to best manage their asthma in relationship to the air quality that they were exposed to. But I don't have that air quality information in my clinic. When I'm looking at their chart in the electronic health record, I don't see anything about their environmental exposures. Even though for all of us on our phones, we get air quality information alerts, but none of that makes its way over to the clinical side. And we have great AI analytics tools to process that, to bring it into clinical context, but that work just has not happened yet. And so that's where I've really, over the past few years, with my background as a pediatrician, but also in the field of clinical informatics, AI, and I'm originally trained actually as a landscape architect, have been trying to connect these dots. And in addition to the obvious links, like air quality, I think it's obvious, poor air quality is obviously bad for asthma. But I see my friend and colleague, Dr. Bruce Becker in the audience, who is a maternal health physician. And one of the things that we've learned over the past decade, particularly in California with poor air quality, is that exposure to wildfire smoke during pregnancy significantly increases the risk of preterm birth, even as little as 1 day of exposure. And so we're uncovering all of these links between how environmental factors directly impact health, but we're not using this information at the front lines of care. We don't have that data. The clinical guidelines and evidence aren't being taught to frontline clinicians. But what gives me a lot of hope and optimism is that we're starting to, by having intersectional conversations and collaborations between the technology, health, financial, climate sides, that's starting to change and shift.
So as a landscape architect, also AI expert, also pediatrician, you mentioned AI and how powerful it could be and will be likely very soon in these practices, but obviously we all understand there's an environmental toll. So where's the balance? How do we know when it's helping versus hurting?
Yeah, so I think everyone is quite excited about the hope of AI in healthcare as well as other fields, and we actually just hosted the first Health and Climate AI hackathon over this weekend at Cornell Tech, and so a lot of great ideas of how AI could be helpful in making sense of environmental data and providing chatbots that can provide more guidance to clinicians, patients, and what to do. But we need to be cognizant of that burden. I actually led a team recently in writing a paper. It's the first framework paper called Sustainably Advancing Health AI, published in the New England Journal of Medicine, really designed for healthcare leaders who are now thinking about the AI implementation in their health systems as well as their sustainability commitments. And I think healthcare systems, because of that principle of first do no harm, I think are really thoughtful about this. And I think healthcare is a large purchaser of AI tools. And what we get to in our framework paper is there's a lot of small decisions can go a really long way. For example, healthcare systems are implementing AI chatbots that communicate with patients. And if you're using OpenAI's GPT-4 versus 3.5, for every single query, that's a roughly 10x difference in energy use and resource use. And so what we're doing is working with healthcare leaders, coalitions, organizations to help understand and weave in as health systems are coming up with decision-making rubrics of, is the AI safe? Is it ethical? Is it accurate? Is it free of bias as much as possible? We want that environmental component to be one of the considerations, and that's what we're helping to advance.
And the transparency of that, right? Because I would assume, especially for groups like yours, knowing that what you're getting sold is 10x, knowing that. And I don't know that we have that with all forms of AI right now.
Totally. Most of the proprietary closed models, we don't have good estimates. There's best guesses that different engineering groups have been able to get to. The open source models do have that data available, but I think large corporations in healthcare and other sectors, when you are evaluating purchasing different AI solutions, you have a role to ask for that, demand that transparency in knowing what is the energy footprint of these different models, and then hopefully that can lead to model developers, technology developers also being a bit more transparent of what their footprint is.
Rob, have you had that experience yet? Have you been able to, or not you specifically, but your teams ask those questions?
We're asking the question, but I think the balance is really important here. When people don't understand the total framework, we can get focused on single metrics like that. My mother was not a financial professional. If I told her that my company was over $4 billion in debt, she would have thought we were about to go out of business. Because debt to her is a bad thing. Emissions are a bad thing, and you get focused on the front end of it, and you think, yeah, but when you use debt for productive purposes, like our cost of capital in borrowing to bring hospitals online and to bring them into the communities is actually a profitable thing. Like we make money doing that. And so you think about this, the totality of what you're doing. AI is incredible because it's a tool that has the promise of helping us solve issues and create all sorts of new pathways to improving. And you have to think about that in the balance of what happens. I'm up here complaining to Seema earlier about the amount of travel that I do. So I'm on a lot of airplanes around the planet throughout the year. And you would look at my carbon footprint and think, God, that's awful what he's doing. And in the last 2 years, we've brought 1.1 terawatt hours of clean power online for our system to get to 100% renewable. I had to get on some airplanes to do that. So we really do have to think about the entire context of what's here and push on the places where we can get better. We can get better in model development. They're working on it. And we can do it across all of our health systems. So please keep the big picture in mind as we solve these issues and not get focused on just one element of it.
Yeah, I mean, fossil fuels helped us get here in the first place.
I'm not touching that.
They did, right? So, but we know a lot more now, and I think that maybe is the difference, is we just have more information. Is there anything that we left out that you guys would want to make sure that this conversation had?
I think the only thing I would say coming out of this hackathon that we hosted over the weekend, it was just so inspiring to see what working together across different sectors looked like. We had amazing leaders from the climate space. We had amazing leaders from the health space, including, leading clinicians, physicians, and we had amazing hackers. And to see what it looked like over just 36 hours, the doors that opened for people to collaborate, including, one person getting a job out of it and 3 of the products actually being lifted up by partners, including McKesson and Stryker, New York Health and Hospitals, and Mount Sinai. I mean, the art of possible is where we are, and we do have the opportunity to leverage tools for good, like AI, but doing it in a responsible way, it gives me hope.
And I think that hope, and Rob, you mentioned the waste when it comes to health, and that's something that I know we're going to touch on next, because this feels very obvious, but obviously there's a huge opportunity in making waste in healthcare better. So that's where we'll go next. Thank you all very much. Please thank the panel. Appreciate you all very much.
Please welcome to the stage Chairman of the Board of Directors for the Zero Waste Foundation, Samid Argabas.
Ladies and gentlemen, when I think about sustainability, I don't think first of policies or data. I think of people. Years ago, I met mother whose child suffered from asthma, aggravated by waste burning. That memory reminds me that climate change is not only about the planet. It is about our health, our families, and our future. The climate crisis is no longer just an environmental issue. It is a public health emergency and a direct economic risk. The World Health Organization projects that between 2013 and 2015, climate change will cause an additional 250,000 deaths every year from malnutrition, malaria, diarrhea, and heat stress. The World Bank warns that the health impact of climate change will cost billions of dollars annually by the end of the decade. These costs are felt in families losing loved ones, hospitals pushed beyond their limits, and business facing lost productivity and rising insurance premiums. One overlooked driver of this crisis is the way we manage waste. Around 40% of the global waste is openly burned, releasing pollutants that cause asthma, cancer, and heart disease. Landfill and dump sites are also major emitters of the methane, 84 times more potent than carbon dioxide. Over 20 years, microplastic have been found in over 90% of the bottled water worldwide, and even in human bloodstreams. This is a not distant problem. It is here, now, inside us. But there is a better way. Zero waste strategy. Protect both people and economies. When cities invest in source, separation, composting, and reuse system, they cut disease risk from rodents and mosquitoes. Recycling and repair generate up to 10 times more jobs per ton than landfilling. We have a real example. In the Philippines, San Fernando diverts over 80% of the waste, saving more than $1 million annually. In Turkey, the National Zero Waste Program has prevented millions of tons carbon dioxide emissions since 2017. In South Korea, mandatory food waste separation cut disposal by 30% in a decade, while supporting local agriculture. Turkey's leadership has gone further. With strong support, Madam First Lady Emine Erdogan, member states adopted United Nations resolution on zero waste. This momentum inspired the creation of the Zero Waste Foundation, which is building awareness, mobilizing communities, and providing the knowledge and tools to turn zero waste into daily practice. The lesson is clear. Tackling waste is tackling climate risk. Every dollar invested in prevention and circular systems yield about $7 in health and environmental benefit. That is true bottom line. But number alone will not our treasury. What we need now is leadership and commitment. Business leaders integrate zero waste as risk management. It lowers cost, protects workers, and strengthens supply chains. Policymakers make waste prevention central to climate and health agendas. Each waste reduction policy is also health and economic policy. Cities and communities keep proving that change is possible. The most innovative solutions are emerging locally, turning waste into value. Let me close with a story that gives me hope. Recently, I met students in Turkey who created a zero-waste school project that weren't policymakers or CEOs, just children separating waste, composting and teaching their families. One asked to me, if we can do it in our school, why can't the whole city? Yes, let's do it. That simple question captures the spirit of zero waste. Change begins with people and it spread outward. By embracing zero waste, we are not only reducing emission, we are saving lives, saving money, and creating a future where prosperity and health go hand in hand. So let us act together. Let us rethink waste, a part of the rethink risk. And let us invest today in a zero waste future that protects us all. Thank you.
Please welcome to the stage former White House National Climate Advisor, Assistant to the President of the United States and Head of White House Climate Policy Office, Ali Zaidi, and President of the United States National Academy of Medicine and United States National Academy of Sciences, Dr. Victor Zhao.
Well, Victor, it's amazing to be here with you. During my time at the White House, our collaborations were one of the highlights. And one of the things that really you impressed on every gathering we got together with was to take this intuition and understanding and awareness that we have and try to channel it into action and transformation. I'm curious how at the National Academies of Medicine now, today in 2025, you're trying to propel that transformation. Not just making sure people connect the dots between climate and health, but actually seize the opportunity.
Yeah, Ali, it's great to see you, and certainly we had a lot of fun together, and we will continue to have a lot of fun together. Yeah, you know, so we got into this area because we are the Academies of Medicine, and of course we think about health in this way. And it becomes very clear that climate change is having major impact on health, right? So as we started moving forward with this, what we call a grand challenge, that really thought about this in a bold way, public-private partnership, not only from a health profession's perspective, but bringing business people, being investors, you know, supply chain, you name it, to work together. I think what we've been witnessing in the last few years, and we've been doing this now for about 6, 7 years, is that there's now really momentum. The good news is that people are getting it. You just listened to the panel just before, right? But I think we're still talking to ourselves. And I think what I want to ask you is, how do we actually go beyond the health and the intersectionality of health to people like in business, investors, and in policy, right? So for us, a big issue has got to do with how to create resilience, right? How do you make sure that, in fact, you have resilience in the healthcare system, where, as you heard every day, our clinicians are seeing people with childhood asthma, from air pollution to maybe struggling to breathe because of, you know, extreme wildfires, right? From heat strokes to strokes from cardiovascular disease, from all the, you know, air pollution and other things. So how do we move from there forward? So a lot of what we do is to build resilience, both in terms of the health system being ready to take on any emergencies, at the same time being able to provide care, train our employees, our health professions, and also being able to work with community to be sure there's adaptation when the extreme weather hits. But the other flip side has been said about waste reduction is that we also recognize the health system is actually a major emitter of greenhouse gas, right? I think the number is something like 8.5% of total carbon emission in this country is emitted by the health system. And where we have a lot of emission, aside from energy use and stuff like that, is also waste and the way we provide care. So we have a big plan going forward. My question is asking you, as a major leader, first of all, working in the White House, and now also with your business background, how do you make sure that this message has gone to the community that you work with?
Yeah, look, I think it's this foundation that you've laid over the last several years and the community has, bringing those connections together is really helpful. But I think what we need to do is go from this macro understanding of the financial and economic toll to a micro understanding. So the World Economic Forum today with the Boston Consulting Group put out a really great analysis, $1.5 trillion by 2050 of cost of toll onto the system. But what's way more interesting than the top line number is when you double click on the wedges, right? So you're talking about $1 trillion of that 1.5 coming from increased treatment burden. And then the rest of it coming from things like the impact of productivity declines in the manufacturing sector, in the agricultural sector, and so on. I think where we need to go rapidly, if what we want to do ultimately is accelerate capital formation and investment in this space, is to translate that, one, into what that means at the micro level. What does the treatment burden mean? Simo was talking a little bit about this. We understand that a lot of people will show up maybe during a heat wave, but what does that mean about our capacity to serve the community? Is that essentially a business interruption risk? Is that a risk to the enterprise value? And once we start to get into this sort of microeconomics of what does this really mean at the firm level for the health system, then we can think about whether it's policy or it's the insurance markets or others who help monetize essentially the front end capital expenditure to deal with the problem. So I think we've traveled a great journey, connecting the dots between health and climate, scoping out the macro, disaggregating the macro into verticals. Now I think we take that to microeconomics at the firm level and then build the markets, whether it's policy or otherwise, to help monetize the benefit of leaning into the solutions.
Yeah, I would say that the data is not all there, right? It's nice to think along those ways and the Working Forum's report, but truth of the matter is that it's really hadn't gone down to a micro level, right? So my question is, how do you get you in policy making, right? How do we as healthcare and health systems message to the policymakers to begin with, but you also talk about the business sector as well. How do we do this? So the way we've always done it would be, tell people, well, let's communicate the fact that people are dying from this. You put a human face to it. That's important, right? But obviously we need to do a lot more, right? And of course now you talk about what is the economic impact to all this thing. So, but I think these days with mistrust of data, information, when I go in to speak to Congress, people in Congress, their eyes glaze over with data, right? How do you actually create a narrative whereby you can bring this information you have, granular enough, micro enough, at the same time engaging enough for people to say, whoa, I got to do something about this?
Yeah, the engaging part is, I think it's fair to say, it's not, the climate community has not cracked the code on that. Otherwise, we'd be sailing towards a different warming trajectory than we are today. Look, I think some of the storytelling that we've been doing for a while, we need to keep doing, and I actually think resonates a great deal. I think helping people understand, okay, saltwater intrusion is not just saltwater intrusion, it's also stroke risk. That's really meaningful. I think helping people understand that wetlands degradation is flood risk, and then it's also vector-borne illness risk. That's actually really meaningful, and helping people build a mental model around that is really powerful. So that's something this community has been doing, and I think we should keep at it. The place where I think we need to engage more, this community, and with I think a vigor in our storytelling, is how the systemic pressure interacts with some of the other systemic pressures we're seeing around the world. So I think about, for example, the heating situation. There is a lot that's been written about AI and the electricity load. And Ginger raised this topic on the last panel because it's a big deal. I teach a class on this. It's very popular. It's like it's the meme stock of electricity right now, is the focus on what data centers are doing. The biggest driver of electricity consumption last year globally was actually cooling costs. We're seeing 4% annual growth as far as the eye can see on a wedge that represents 20% of the share of energy costs at homes all around the world. So I think we need to intersect some of these topics together. Okay, what does it mean if we are failing to think through the implications of heat effectively, not just for our health system, but put it into conversation with some of the other fragile systems? The other is, I think, and this is where health professionals and leaders of health systems need to step up, and that's helping people understand what is that systemic risk where the hospital has to put a stop sign up and can't take customers, can't take patients because of the impacts. And that's where we get into not just the climate impacts, but actually this resilience conversation, investing in it.
Okay, I want to change our topic, talk about beyond health sectors. Because if you think about all the sectors, agriculture, energy, transportation, construction, right? They all think along this way. How much carbon, what is our consumption? What's our emission? What's the economic cost? Then we make interventions, mitigation, whatever policy, right? But they never consider health in many of these decisions, right? And you start putting health into the consideration, suddenly you kind of wonder, is that really strategy the correct one? Because we have not considered not only lives, but also the cost, as you said, of health and bad health altogether. How would we engage this kind of discussion?
Yeah, look, I think getting public health professionals and leaders screening our decarbonization pathways in all of these sectors is really valuable. Victor and I had the opportunity to go to his alma mater, and one of the presentations at McGill was about the increase in asthma attacks that was brought about by tree planting in urban areas. So really obvious, right? Urban heat island effect. We're all doing it around the world. We're planting trees in those places to help cool. You plant the wrong trees, and you actually put a bunch of pressure on the pulmonological system, and then the organization set up to deal with it. So getting that screening in as communities are developing the interventions, I think is incredibly important. I also think in addition to pivoting some solutions or decelerating them, they might accelerate some of the solutions as well. We saw this in the COVID context in terms of buildings and the improvement of HVAC systems. People are super conscious about what they're breathing in, what their kids are breathing in. If we get more of that health bottom line injected in the conversation, I think people are more likely to pick it up.
Yeah, but I don't want to leave this conversation because globally this is such a big issue. Health in all policies, health in all decisions, right? How do you introduce this? So at Academy, as you know, we have launched a thing called system transformation, a roadmap, which will bring together all the different sectors and also high, low-income countries to look at how do you embed this kind of idea. So the macroeconomics you talk about is usually looking at what I said earlier. What's the economic impact of every one of this industry? What we want to do is introduce a new economic model, a well-being model. You get to net zero, but you have to measure everything around health and its impact economically as well.
Yeah, and I think one of the most remarkable outputs, early outputs of the process that you're running, and I'd love to maybe have you tell the group about this a little bit, is not just the substance of what you're doing, but the partnerships you've built around the table. I think this is a unique space where we're getting a diversity of players around the table relative to some of the other conversations that are happening in this hall.
Yeah, partnership is everything. I mean, we look at within our sector already partnership between those who deliver healthcare, to supply chain, to educators, to policymakers. So we have a collaborative that we bring together pretty much the major players from all sectors, business, academia, government, and healthcare, you name it. And then beyond healthcare sector, as I mentioned, partnership with all the other businesses, all the other sectors to work together. The whole idea is to focus on how to improve health altogether.
And I think this is a model we need to replicate from a corporate governance perspective. Every major emitter should have a health expert on their board of directors.
There you go.
And by the way, every major health system should have energy and climate expertise on their board of directors. I think it's got to be every single table where decisions are getting made, whether they're in policy or in civil society or in the corporate space, needs to reflect this well-being perspective. So I think it's insightful, and hopefully that playbook of partnership is one that we see replicated over the coming years as well.
Well, I can help you ask the last question, I think, which is policy. So you've done so much when you're in the White House. You think about all the different bills, provisions, laws that went forward. And of course, we're seeing a pullback in many of this. How would we now, as a group community, think about moving forward? How do we actually make sure that some of the infrastructure investment and many others will continue?
Yeah, there's a little bit of reversal going on in the United States at the policy level, but it's important to keep perspective of how much not just the direction is being maintained, but actually a lot of the momentum is being maintained. So this bill that reversed part of the Inflation Reduction Act, even on the other side of it, we still have tax credits for nuclear, for geothermal, for hydropower. We have tax credits for battery storage, which, by the way, when it's deployed, improves the value of solar and wind. So if you're in the healthcare sector and doing the kind of operational work that Rob's talking about, you still have massive advantage deploying clean energy here in the United States that enhances, augments the built-in economics of the technology. So that's thing number one, is I think to know that we're actually standing in a pretty good place. I do think on top of that, we're going through a real churn on institutional trust. I don't need to tell this group that, but what I think that throws back at us, those of us who believe in our national labs and our world-leading research complex and the healthcare professionals that have saved billions of lives through their work. I think the premium on delivering results faster and showing them very clearly, showing where they came from, is higher, because there's a trust rebuilding exercise that needs to be done, absent which it will be hard to have that next wave of infrastructure law or that next wave of globally leading research and development, the next wave of development aid. We need to connect the dots between those two. We need to help people feel the benefit in their lives. We do ourselves a disservice if we pretend like people do trust these institutions blindly. They don't. There is an erosion of trust. We need to attend to it, but we have a really good foundation and the right team to go about it.
You know, they gave us only 15 minutes. I think we can continue for a long time. And in fact, I certainly look forward to continue working with you.
Likewise.
There's a lot of things going forward. Thank you very much.
Thank you.
Ladies and gentlemen, please welcome to the stage Chief Scientist and co-founder of the Volo Foundation, David Vogel.
All right, mic check here. All right, well, I'm honored to be here today. I'm going to try to cover all this in 10 minutes or so. But basically, I'm the founder of these three organizations. The one commonality between the three is that the decisions have been guided within these organizations based on data science principles. So really, a career data scientist is what I am. And the Volo Foundation, when we first founded it in 2014, we actually didn't know that we were going to be so focused on the environmental program, but we did the data science. We analyzed 1 million years of history based on ice core information and looked at data based on fossil fuel companies, what they were publishing, and saw that we were just 15 years away from the next degree of warming, which was going to have very severe consequences. So we became very, very focused on decarbonization and raising awareness for the changes we need to adapt to. Then sort of go 5 years before that, Volo Ridge Investment Management. Just a little history about that is we were really questioning a lot of the dogma about how investments should be run, because our data science was sort of leading us to different results. So we developed a system of investing and predicting stocks and making investment decisions all based on data science. And we were very unpopular in the beginning. We were only able to raise $90,000 under management, including the $10,000 in my bank account. But as we saw the system really work and really outperform, we grew exponentially to $1 million under management, 100 million, $1 billion, and then we hit 10 billion under management. And we got to a point we couldn't take more investors, and we basically now at a point where we actually return capital. And again, this sort of showed that you could question the norm and the accepted way of doing things through data science. So now, sort of fast forward to just a few years ago, I sort of saw a similar pattern in the health space. And so I'll tell a little bit about my story. I got to, I hit age 40. I was only maybe hitting the gym 1 or 2 times a week. I was eating horribly, lots of sugary drinks, Coca-Cola. And then I started, I saw that my cholesterol was high. And again, the guideline for LDL, or known as the bad cholesterol, is to be under 100, and I was at like 145. So to me, that was a substantial risk. So I started exercising more, and the cholesterol stayed there. And then I started eating healthier and cut out the sugary drinks. And then I exercised even harder and more, and the cholesterol stayed there. But I knew I was getting healthier, and something just didn't seem right, and I decided not to go with taking medication to lower my cholesterol. So that's what sort of led us to really study this on 500,000 people, and now our data set's expanding to millions of people. And we said, okay, let's look at the people within the range, LDL less than 100. This is the recommended range to be in for cholesterol. And it does actually yield a 20% reduction in risk. But what most people don't know is actually only 5% of people over 55 are naturally in that range. So it's actually unnatural to be in that recommended range without taking cholesterol medication. And we said, well, in data science, we typically don't just look at one predictor, one outcome. We look at all the predictors and all the outcomes. Heart disease is an important outcome, but it's one of many. And that's where we analyzed all the other outcomes. And we saw that the people with the lowest cholesterol had all kinds of adverse outcomes aside from the heart disease, and that's when we realized that's sort of where we said let's go from from research to maybe creating, trying to fix the system through a company. Further, it was sort of, the skeptics sort of said, okay, well, maybe those are people already almost dying, have low cholesterol, and it's a reverse causation. So we graphed this out. Actually, I'm showing 10 years, but we've done this out to 15 years. The top line, this is mortality rate over time. The green represent the 5% people not on cholesterol meds who naturally have cholesterol under 100 as recommended. And the yellow line under that represents people in the higher half of LDL cholesterol, and that's mortality rate. And it's not people people dying in the next year or two. This goes out 15 years, this pattern. So the people naturally with the low LDL cholesterol turns out are not the healthiest group of people overall. So we went in to analyze this further. We graphed again LDL. This is men and women risk, sort of LDL level versus risk of a cardiac event. And we said, how can we create a resource or a visualization that helps people see the whole picture? And so you have sort of the ranges of LDL cholesterol going down. We're going to have diseases going across. And really the only piece of information that we know or is normally presented to us and is often studied is the fact that, okay, there's a risk multiplier of maybe 1.4 or 1.6 associated with the highest cholesterol group. And only about 5% of people are over 175. So that's the very, very highest people at risk. But 90% of us are actually in the middle, and I was one of those, smack in the middle. So what is our risk multiplier for a cardiac event? And it turns out it's not very high. Maybe not as critical, or maybe the metric we should be looking at for how healthy we are. So we said, let's fill in the other diseases, and let's create a guide with this and all the other biomarkers. And it's also important to know that men and women have different different relationships with these variables. So we did this separate for metrics, and then we sort of rolled this up into a health score, because now we got all these other predictors of cardiac disease, not just LDL. So let's just come up with a risk multiplier relative to our disease. And that's when I saw sort of years later that I had actually lowered my risk of cardiac event by about 75%. And so that's basically what led us to decide, okay, what we want to do with the health system. So a couple resources we put out there. Again, these are free resources. This was a collaboration between Vola Ridge Health and the Vola Foundation to sort of put this out there, showing like that exact visualization with other markers and helping people understand what should we look at. Like HDL cholesterol, the good cholesterol, is actually much more predictive than LDL, but it just so happens that a 5-point difference can be very, very meaningful, and people don't notice it as much. Men and women have again, very different risk multipliers on HDL. That for women it should be about 8 to 10 points higher than for men, but we sort of look at the same recommended range. Cystatin C is one we often don't measure, and it's actually the most predictive marker that could be in our blood test of a cardiac event and also many other conditions. So really our goal is to create this sort of operating system that could be inserted into the health system. Any business, or academic institution could access our health scores and basically anything I'm about to show you. So that, like, for example, right now, we're looking at this is what our health report looks like. We got a bunch of biomarkers measured. Nobody knows how to interpret it. Most doctors don't know how to interpret it. I'm guessing Victor there probably can interpret all these markers, but he's in the 1%. But again, if you go from something like that looks like that to actually something interpretable, where you can actually see what is my risk for the various different disease groups, and very quickly scan what are the 5 best things, 5 worst things, and have a health report that's a bit more impactful. So run out of time. I won't go into the detail but there's sort of disease-specific pages that could be put in here. You can actually take someone, this was an actual person's data, someone who's very unhealthy, they're on a trajectory, they're 55 years old, smoking, on a trajectory toward very poor health and health risk by the time they're 70, and you can actually show using these models that person could change that trajectory if they quit smoking, bring their BMI down to 23, improve these other biomarkers. In terms of testing, again, this system has to be expandable because we have the current blood test, which is limited in predictive value. But we're also looking at all these advanced technologies and trying to bring them to market where you can measure things better. You can integrate genetics, we're looking at proteomics, even epigenetics, which have a higher degree of predictability and impactfulness. We're going, right now you have to go get a phlebotomist, get your blood test. That's becoming less invasive. At-home finger pricks, even some wearables that measure proteins in your body. So that sort of brings us to what should studies look like? How would we, with a good data science system, how would we actually do studies? Because right now, and again, I'm making up these numbers, but I chose high protein versus low protein because it's a controversial topic right now. I don't actually know the answer, so I'm making up these numbers, but one study might show high protein's better because they're looking at A1C as your output variable. And another study might show low protein's better because they're looking at a different variable. And there's 1 million of these published every year, so it's very confusing, hard to interpret. So really, we said, how can we use data science to create a study design that gives an accurate and complete picture? And we're actually funding some studies like that, which I'll get to next. But you measure all the biomarkers, you do the same intervention, high protein versus low protein, or whatever it is. Oops, actually, this did not come out very well on the screen. But the idea is that you would have a risk comparison across 7 or so different disease groups, and based on the roll-up of all those biomarkers. So it would be interpretable, it would be complete, and it would provide an accurate depiction. And you actually need a lower sample size for that, because when you have a roll-up of lots of biomarkers, you get statistical significance with a much smaller set. So that's really kind of what led us to how do we want to do some environmental studies. And again, we're doing other studies, not just environmental studies related to health. But there are 2 major grants that we did, and we want to integrate our system of actually evaluating the output of these studies using sound data science. We're doing one studying the effects of the wildfires in California. So we had blood work before and after. We're doing one where the Vanderbilt study, where people are wearing bracelets, that collect information on air pollution and correlating that to their health. And basically, it's with that whole new study design that. So basically, we're at this point we're looking for collaborators, believers in this new system based on data, potential early adopters, and that's basically what we've been up to with with Villa Ridge Health and our environmental studies. Thank you.
Quickly say goodbye. David, you did well when every camera was up, taking every picture of every screen. Everyone's like, what? My LDL's okay? Thank you all so much for being here. Obviously, there's great interest in our health and our environment. And so we've done it. We've started the conversation. I hope it doesn't stop. Thank you. Enjoy the rest of Climate Week.